Namaskara. Good morning to all the viewers. My name is Dr. Raghavendra Prakash. I'm a physician with special interest in diabetes and infectious diseases at United Health Hospital, Bangalore. To keep it brief and short, a small message about why preventive health checkups. As the common saying goes, prevention is better than cure. It has not been quoted or used without a reason, especially so when it comes to human health, diseases and its prevention. Among the human illnesses, majority, that is more than 80% of illnesses are non-communicable, chronic and largely asymptomatic. That is, they don't show up symptoms until the disease accumulates to such an extent where complications happen. So the idea is to pick up the diseases early, treat early, or bring up lifestyle changes so that the disease progression is stalled or slowed. Now, which are these few diseases which are causing a havoc among the human population, increasing number by the day, and which can be prevented? These are, number one is type 2 diabetes. As you know, India is the capital of type 2 diabetes, unfortunately. But if the Indian population mindset and if they take up this issue in a right and positive manner, we need not remain as the diabetes capital of the world as quoted by the literature. I would be happy to see a day when India is not the diabetes capital of the world. It is possible if we follow our traditional, our grandmothers and grandparents' way of life, eating, discipline, wake and sleep, and our attitude to life, much of the problems can be settled down. This is non-technical, of course. Technically, the 5 diseases which can be prevented are diabetes, hypertension, cholesterol-related issues, which in turn leads to cardiovascular diseases, fatty liver, what we call as non-alcoholic fatty liver disease, problems related to obesity and overweight, osteoporosis, and certain lesions in the female, the breast lesions which may go unnoticed if not checked, and cervical lesions. Cervix is a part of the lower part of the uterus in women, which is hidden from plain sight, or which the patient or the lady may not notice it. These are the few illnesses. The first one is diabetes, of course. It can be very well reversible or treatable when picked up early. That is why we do preventive health checks, where random blood sugar or a HbA1c is part of the health check. Hypertension. A simple BP examination by a trained medical profession in reasonable intervals, like once in 6 months or once in a year, can go a long way in preventing complications of hypertension, which are bleed in the brain, myocardial infarction, that is heart attacks, chronic kidney diseases, chronic kidney problems, which cannot be reversed after a certain extent. So pick up diabetes, hypertension early through preventive health checks and treat it. The other things that are increasing nowadays in this list are thyroid illnesses, subclinical hypothyroidism, thyroid disorders, which don't show up much symptoms, but when you check the blood, there is derangement of thyroid, which can be very well be addressed with simple medications, observation, and then timely treatment. The others in the list are there, of course, like fatty liver, thinning of the bones in women during the perimenopausal age, postmenopausal age, and certain cancers. So the first 3 to 4 very well treatable, preventable diseases can be sorted out through preventive health checks. So my all supports to preventive health checks, especially so if it is done in a focused way. If you can meet a physician before the health checks are done, Let them examine you, talk to you, take a clinical data about what are the tests that are relevant in you, and then go ahead with it. This is our approach. I hope it has been informative to you. For any further queries, please contact us on the below mentioned channels and through our hospital. Thank you. Namaskara.